you know, in the, you know, past, basically what it was, you know, we were so focused on the patient that we didn't really think about what was going on at home, what was going on with the family. And now the patients are getting discharged a lot sooner and a lot quicker, and they're going, and a lot of people want to go home. Some do go to rehab, some do go to subacute, some actually have to go directly to nursing homes, but most of them just want to go home, and we find that they're heal better when they are at home. So there's a lot of discharging directly to home, but there's not a lot of thought as to, is that caregiver prepared for the work that's going to lay ahead of them? Have the families discussed what's going to happen? I just got off the phone with my sister, whose father-in-law is coming out of the hospital after having some cardiac incident. And one brother-in-law wants to put a hospital bed in their living room, and the wife, his, you know, wife says, "Oh no, over my dead body." And another one says, "Well, I'll just come and take them upstairs and downstairs at the beginning and end of the day." And two sisters from out of the, you know, country are weighing in on it. And my sister just said they're going round and round and round. They have a house in Florida, a house up here. Should they live here? It's just real, it's like a crazy time. And so I kind of talked my sister off the ledge and basically, you know, said, this is what happens. Nobody prepares. Everybody thinks they have tomorrow. And then all of a sudden something happens, and the father-in-law's getting discharged home from the hospital tonight, and there's been no preparations made for what's going to happen when he gets home. So basically, hospitals have begun to say, okay, we need to help the caregivers. By helping the caregivers, will also help the patient, and everybody as a whole will heal together much better if there are resources behind both of them. So with the Care Connections model that we developed here at the hospital, it has 4 big components. So it has a caregiver navigation service, a caregiver university, which is educational programs, caregiver baskets, and also then we have supplies and equipment that we can help support for needs-based purposes only. So we started our caregiver program back in October of last year, and we were just looking to focus mostly on the patients in the hospital, with the model that we would have a social worker develop and train caregiver coaches. They would go up on the floor. They would interact with the families. They would be active listeners. Pam can talk a little bit more about this, but they would be active listeners and engage the patients in the hospital, their caregivers. But what happened is, when we partnered with the county to do programs from what was from the grant, we expanded ourselves into community-based caregiving services as well. So when we're talking today, we're talking about the program that develops around both hospitalized patients and patients in the community, and helping their caregivers no matter where the location is, with one or all of these services. So basically, we'll start with like the care navigation. So care navigation is, you know, following along the lines of what patient navigators are. You may have heard of them. They're used a lot in oncology, and they're basically there to lend support to the family, to help them through the healthcare system when they have questions, to help them connect services when need be, and just help be a guide. We also want to be a shoulder to lean on. We want somebody, you know, if they're having difficulty with the responsibilities at home. And again, Pam will talk more about the kinds of cases we're seeing, but there's a lot of dementia and Alzheimer's cases that we're seeing. And sometimes they just want somebody to hear them and listen to them and say, you know, this is not the same person that I lived with for the past 40 years, or this is not my mother, how I remembered her. And so, you know, there's a lot of emotional issues that need to be addressed. So we want to address them as well. But also, as I was just giving the example of my sister, there's obviously family communication that needs to occur with somebody who wants the hospital bed in their parents' living room, to the other sibling who says, well, I'll go in the morning and bring them downstairs, and I'll go back at night and bring them back upstairs. And then there's everything in between from the other siblings. So there has to be some kind of communication. And how is that communication going to happen? So the caregiver navigation will help coach along that kind of communication. So that's another valuable thing that we offer. And then again, there's connections to the healthcare and healthcare community, as well as to community resources. A lot of times I was talking to my sister and I was saying, well, you know, are they getting somebody in the home? What about getting some remote patient monitoring if they're worried about his heart and he could be monitored from home? And that way nobody has to come in and live with them. And there's a lot of options out there, but you need somebody who's really well-versed in that in order to be able to help other families. So I just put in a quote from one of the recipients for our care navigation program that Pam, and some of you are familiar with Cornelia Schimmert. So Cornelia has been also helping me with it. So both Pam and Cornelia, and basically one of the quotes is, with your supportive and kind guidance, I'm much relieved and have hope. Thanks for your TLC. And a lot of times, it's really just the relief of knowing that there's somebody out there that they can reach out to, that there is a support system and they're not all there on their own. And that makes a huge difference to the caregivers. The Caregiver University is basically education programs that are developed to help caregivers with learning how to best provide the care that they have to and still take care of themselves and still be supportive of themselves. So we have two different programs essentially. One is called your Caregiver Contract and the other is called Building Better Caregivers. The Caregiver Contract is a 6-week workshop. It's from the caregiver's perspective. It's from somebody who is a certified caregiver coach and also has, blog, has written a book, an author on it, all from the perspective of what the caregiver has to look at. And some of the things that they focus mainly on is the changing relationship. She was a caregiver or is a caregiver to her mom. And so before, the mom was the strong one in the family directing her daughter as to what to do. Now, all of a sudden there's role reversal. And now the daughter is directing what the mother should be doing. And how does that happen? Because the mother's still cognate, has very good cognitive skills, but she just physically has some issues. And so that doesn't mean that she needs to turn her whole life over to her daughter. She just wants assistance in some of the things that she needs to do. And yet for her daughter, she needs to set boundaries, because if she doesn't set boundaries, then she herself is going to be going down with the care recipient. So you have to make sure that both receive something from the interaction that you have together. So that's the Caregiver Contract. The Building Better Caregivers is a 6-week program, and it's really designed for people who are dealing with someone who is cognitively challenged and have memory issues like dementia or TBI or PTSD or something along those lines. And they work with both, again, Cornelia and Deb Castle help with that program. They're the facilitators. It's the county's program. And they give a workshop where they work with caregivers on coping strategies and delegation of stress and the development of support systems. So it really is over a 6-week period, engaging an interactive program where the caregivers really learn how to be a caregiver. And it may sound simple, what is it to be a caregiver? But those who have done it really know that there is a lot more to it than just saying, I'm going to be there to, dole out the meds or whatever it is that they would be doing. As far as the needs-based supplies and equipment, there is some portion of the funds that are available from the grant, but there are some contingencies to it. So we can help with financial support for disposable medical supplies, as well as for durable medical equipment. Sorry, okay. But we need to make sure that the funds are used as efficiently as possible. So it's for people that have not non-reimbursable through their insurance. Sometimes there's co-pays, and for a needs-based family, that becomes difficult. And it needs to be, again, for needs-based eligible person. We're getting calls from people who have family members that are on Medicaid, and the additional cost of potentially replace a wheelchair that needs to be replaced, or the ones that have the seats and are on the wheels, the rollators. Sometimes that isn't covered, particularly if it's in addition to a full wheelchair. And it also needs to be prescribed by a licensed provider so that we make sure that the need is there, or that we're actually addressing what the need really is. And then we have caregiver baskets. And basically, the state was hoping that we could do something to offer respite services. But as this was being developed during some of the height of the COVID, we were in a situation where not only did we not want to go into people's homes, but people didn't want us in their homes. So we thought, well, what else can we do to just give some support and emotional boost to caregivers? So we developed a caregiver basket. And if you just look at the picture there, and basically you could see there's a kind bar in there, and there's lotions from Burt's Bees lotion set, and this is an aromatherapy candle, and this is a tea mug, and these are different types of herbal tea. And then there's different literature Pam had looked at that thought would be appropriate for caregivers. So some resources that they get. And so there's a journal that's underneath there. There's a pen that's there. And so it's just a nice little box to say, you know, we're thankful for what you do. And one of the comments from our care recipients is that, you know, thank you for the beautiful caregiver basket. I could not believe it when the beautiful box arrived at my home. It made me feel like people cared about me and that I was important too. So basically, with that, I'm just going to leave you before we turn it over to Pam, is what I was saying before when I was talking about my sister's family phone call right before this presentation is, you know, have you asked or has your family had any discussions as to who will take care of the older family members as they age? And are you as a family prepared to take on additional responsibilities of caregiving? And I know a lot of us have been in this situation, and I previously had been in a situation where all of a sudden my mom needed support. She lived in Arizona. 3 or 4 out of the 5 of us were here in New Jersey. One was out in Arizona, but couldn't take on the full load. And we were basically trying to discuss, what do we do? You know, who's going to be responsible? And it was a conversation that had to be had rather quickly. And with all different personalities involved, it's a little difficult sometimes to work through. But that's what our care navigation is there for, is to help people work through it. But it's just a reminder that, you know, if you haven't started these conversations with your family, that it's always good to start it ahead of time so that you don't wind up in a situation where it becomes a crisis mode. And with that, I will turn it over to Pam, and then we could possibly answer your questions at the end. So thank you.
Thank you. Thank you, Ellen. I guess I'm not going to be able to have video. I think it's not working. So, right. So I'm just going to talk. Hi, everybody. I'm Pam Lipperman. I'm a social worker, 42 years in the field of mostly working with seniors in the Westchester County and all kinds of different levels of work, both a continuing care community, low vision clinics, daycare, adult daycare, hospice care. I've done it all, which is really great because it brings me to where I am today, helping caregivers in the community trying to meet the needs of their loved ones, because all of these questions come up, or all the need for all this information is helpful when they call me. So I'm just going to give you an idea of what it's like when someone calls. When they call, they're not even sure what to do with us. They're not sure why they're calling. They're not sure what a navigator can do for them. We always start by asking them to let us know what their story is. Tell me what's going on with you. How are you doing? And we're asking about, what they're doing to take care of their care recipient, but at the same time, how are they doing? And sometimes they're surprised by that because they're so used to going to doctors' offices and just reporting all the stats about the patient and how they're walking, how they're eating, and all that. And suddenly someone's asking about them. And they really appreciate that. And we'll talk a little bit more about that as we go along. we always make sure we set aside about an hour, hour and a half the first time we call someone, because it does take a long time. I find that the caregivers Can you hear me? Yes, Catherine, just not yes.
We can hear you now, Pam.
Okay, so I guess I left off at, we set aside an hour or so to talk to caregivers. Is that where we left off? Because I kept talking. Okay, anyway.
Yeah.
So we set aside that time so that that we are focused on what the caregiver has to say, that we give them enough time to share what they're concerned about. They really appreciate that, because generally when they're in doctor's offices and everything is very, is sort of rushed, and they only have a certain amount of time. So they really have their time to talk about what they're concerned about and everything that's going on with them. It also helps them, because at the end of that part of the conversation, we ask them what are the most, because there's usually a load of issues that they are covering, or many things that they're covering. But then we ask, well, what are the most important items right now that we can focus on? Let's pick 3, and we sort of start there. And that's where, they tell us at this moment, this is what is most important to us and what I need the most help with right now. And our intervention is usually of 3 things. Support, and that is basically being a neutral person that they can talk to about the situation. The feedback I've received from many caregivers is they can't tell me what a relief it is just to talk to someone who is professional, who has knowledge about what they're going through, but we're not, not judgmental, and we're not giving our opinion. I guess, just so you know, family members can tend to be very opinionated about how someone is providing their caregiving services, or they try to tell the caregiver how they can do it better, and all of those things that occur. So they're so happy to just have a safe place to talk about this without fear of being judged, and really with just, being able to sort of look at it openly like that. The second piece is we give resources. So based on what they've talked about or what they're most concerned about, it could be housing. It could be about how to talk to someone with dementia. It could be someone that's driving and they're very concerned about their safety. I'm going to give you a few scenarios at the end of some specific cases, but it's varied. It's very individualized. So we just listen to what that person needs. We have a library of resources that we've developed. So we email it to them. We have been mostly meeting with people over the phone virtually. They are allowed and welcome to come here to the hospital. But as you know, most people have trouble even getting time away from the care recipient. They're thankful that they can do this virtually. And many things are done by email. And they like that too, because they can respond right away. And they can, they have it as a library themselves. They have it right at their fingertips. Another role that we play is sort of coaching. Example, I had a gentleman yesterday, and he has a 58-year-old wife, and he said that she's falling every day. Well, further examination, he does have a physical therapist coming in the house, and I told him, safety has to be number one. And he needs to talk to the physical therapist. What is the most safe way to have his wife ambulate? Is she assistive too? Does she need a walker? She should be out of bed to the wheelchair. Like, he needs to ask those questions and follow those directions, because her falling every day, we know, is not safe. Well, to find out further on, he's taking her out every day. He's taken her to a fair. He took her to the grocery store, and he could not change gears. She's only 58, his wife. He really had trouble shifting gears. He feels she's young. He wants to, provide these opportunities, and that was what he was focused on. But trying to coach and get him to accept that right now, for today anyway, she's not safe to be doing all those things. We need to make her safe, and then figure out a way that we can make those things happen, but not the way he's operating now. But it was, that was quite a challenging situation. So that is the other thing that we do is coaching. So, being a caregiver, let's see. Oh, there I am. Okay, hi everybody. So, in being a caregiver, it draws on so many, affects so many things, physical, emotional, social, financial, your relationship with your family members. There's so many things that are impacted. So we're here to help with all of that. I've been involved with mediation with family members, because there's been such a disagreement between family members, how to go forward with a family member. So we're here for all of that. I think that another really important part of our conversation is, the financial part of it, which, again, we're not here with all the answers, but we're here to give you resources or give you experts in the field who can help you with those things. So finances are very important. Someone I spoke to today, she's just starting with this. Her mom has early dementia, early cognitive impairment, and she doesn't have a clue how much money her parents have, what their pensions are, what insurance they have. She didn't know any of that. And I said, they've been independent, and you didn't need to know, but now is the time to have these conversations, because that will affect what you're able to do, what kind of planning you're able to do for them. And you have to explain it in that way, because many of these parents, I don't know if any of you, have parents that were like this, they really don't want you to be involved. And, but there is a point where in order to make safe planning and planning that you can do before a crisis occurs, it's nice to be prepared. That needs to be part of the conversation. For her, she was interested in memory care, and depending on their finances, what can they afford? And she recognized that. So that's why the finances are important. And always advanced directives. I come from hospice and worked with geriatrics my whole career. You'd be amazed at either how many people don't have advanced directives, or maybe they've signed it, but it's put away in a box somewhere in the house and nobody knows anything about it. The kids don't even know who is a proxy. That means if they don't know who the proxy is, then those conversations haven't taken place about the wishes of the caregiver or the care recipient. How do they define quality of life? What decisions do they want their proxy to make? Those are such important conversations. I offer assistance with that if they need a facilitator for those conversations, because sometimes some people aren't comfortable with it. Also, I always recommend, if they're in the hospital, to ask for a palliative care consult. They're experts at helping with those conversations. So there's so many things to cover. It can't all be done in the first visit. As I said to you, the first time around, we highlight the first 3. And then it's interesting. Either they're good and they don't need something from us for a while, but then they round back with us when something else comes up, or we're having a few sessions with them and getting everything, all those things, advanced directives in place, and getting, maybe going to an elder law attorney and maybe getting a geriatric case manager to help them with a Medicaid application, whatever it may be. And then they're good. So everyone's very individual and different, and we just meet them where they are and take their cues. I have one gentleman that I've been reaching out to, and we're sort of back and forth here, but meanwhile, and he left a message with our caregiver center here today, or a day or two ago. He wants to hear from me again. He has my contact information. He didn't call me, but so I reached out to him. It's just sort of that you just have to really take them, meet them where they are, and just be here, when they need us. So I thought I would tell a few, let me just make sure I touched on everything I wanted to do. Oh, and one of the other most important things is going back to the caregiver. Are they taking care of themselves? I mean, I had about four meetings today with new caregivers, and I hear their voice and I hear them just running and spinning and all of that. It's so hard, at least at first too, when it's something new has happened or a crisis has occurred. But that's one of our roles here, is to give them permission to take care of themselves. I always say to them, this is a marathon, it's not a sprint. So we talk about resilience. We talk, what are we going to do to make this be sustainable? That how are you going to sustain, if you're going to keep running on all these gears and like you're on caffeine and you're, these 16-hour days, that's not going to be sustainable. So what resources do we need? And what do you need to do? Maybe people are offering help and you're not accepting it. Maybe you have a sibling who doesn't know what to do, but with some direction would be able to come and help. We don't know, but we figure that out. And the other thing I always recommend is journaling for the caregivers. And that's why we put it in the care basket, because sometimes I had one caregiver that I spoke to at length about many, many things. And then at one point in the conversation, she said, I'm sick of talking about it. I said, oh, and she goes, but I need to tell you all this stuff. I said, well, remember that journal? I said, why don't you take the journal out so you don't have to talk to me all the time? And so write it down. And then, that way you've gotten it out of your system a little bit, and it's something to look back at. Sometimes it's nice to keep track of where the patient is and what they've been doing and the decline sometimes, and that helps with decision making as they go along. But we recommend that too. Okay, so I'm going to just tell a few scenarios because it's not all about elderly people. Actually, here at Phelps, we have behavioral health also, and they've asked, and we're available for that. Again, we're not experts at everything, but we know how to, direct people into to resources, or we do some research and find out answers too if we need to. So we had one couple. The patient was in his late 30s and he had a severe stroke, actually. And a physician referred the wife to me as a caregiver. And so we sat down and she talked, and then she looked at me, as I said, they're not always sure what to do at first. And she said, I guess I need information on strokes. And I said, well, you're going to be going to Burke. Her husband was going to Burke. I said, and I knew she was a mother of 3 young children. So I said, let's talk, how are you doing? Of course, the tears started. Other people Phelps is a great place. Our staff is very caring. I'm sure people were checking in with her. This was her chance to just talk about her. And because this is devastating. I mean, she's in her 30s. You're not expecting this. You're not thinking, is this going to happen to me? This year you've been sideswiped. And so we went through all that. And then we talked about self-care, even though, of course, she's overloaded between coming to the hospital and 3 young children and things like that. But she talked about things that she had done for self-care before. And she is making a commitment to herself to, do yoga and some meditation, at least 20 minutes a day, that she was going to fit that in. So, and she felt relieved that she was going to keep, she goes, I always feel better when I do that. Yeah, well, then you need to do that. You know, again, using that example of putting the oxygen, you know, on the airplane, you're supposed to put the oxygen mask on you before you start taking care of the people around you. It's the same idea. And then we talked about her 3 children, about she didn't know how to even tell them what happened, or how to explain to them what you know, what their lives are looking like right now, and should she bring them to the hospital? All of those issues. Not sure if she had discussed that with anyone yet. And so we reviewed that. And then the other thing that she was telling me that everybody's bringing meals to her porch, and you know, it's a little overwhelming also. So I gave her information on starting a meal train. You know, there are meal trains that you can, your neighbor, and in fact, maybe a neighbor would be happy enough to coordinate that for you. And so then everybody's signing up and they're bringing meals in an organized fashion. So you're not getting 10 meals one night and nothing the next night. So that's just a little example of something that was very helpful. So that just sort of reset her for the day. And you know, she was going on to Burke, so she's not going to be ours. They have a beautiful, wonderful caregiver center there too. But anyway, that's one example. Another example was another sort of somebody in their 60s, and his wife had cancer. So I reached out to him, and he was you'll see this with family members. They know what the O2 saturation rate is. They know what the blood pressure is. They know what the weight is. They've got all these statistics. They have all this terminology now, and they're used to reporting to the doctor. They're used to staying on top of all this, and they think they're doing a good job, and that is part of it. But in this situation, this couple and the wife was becoming very sick, actually, but still seeking treatment, and you know, and he had that all under control. But when I asked about his 9-year-old daughter in the house, he just thought, well, she's okay. She said she's okay. And I thought, you know, I'm not so sure about that. You know, you're very busy doing all this, and your wife is very, very sick. That's got to be so scary. So we talked about resources, about books that you can sort of give to the child. I gave him information about what's age appropriate at that age, to be what she's able to understand, and maybe her emotional reactions and things like that, just to give him that, because I do know that, you know, when you've got someone sick in the house, other family members they're not forgotten, but they are put on the side, including yourself. You know, if you're the caregiver, you're putting your own needs on hold. But that 9-year-old could be very impacted by this. So anything that we can do to help her. And there are organizations, there's, you know, the Treehouse has support. It's a place in White Plains. So there's support networks out there as well. So I'll talk about support. So we often refer to support groups. We have support groups here at Phelps. We have a list of support groups. I often ask my caregivers too, what did you find helpful? And I have to say a few caregivers have said to me, the support groups were priceless. They felt talking to a peer who's walking through what they're going through actually was very helpful. One caregiver said to me that she felt relieved because she got permission from her group to not visit the hospital every day. The husband was in Manhattan, and she's running back and forth to Manhattan every day. And they just gave her permission. You don't need to go. You don't have to go every day. Can't you get somebody else or work something out? And also to take care of herself, that they reminded her, because they are caregivers too. So that was very helpful. I would say, you know, for dementia, I mentioned generally, so many issues come up with dementia. It's such a rough illness, and there's so many levels of care that you need throughout that progression. So that can change so many times. I had one family member, her mother was acting out, paranoid, you know, just really difficult because she was in her own home, living with her son. The daughter brings her here to her home, And she just sort of made it like a whole comfort situation, just made it. And she has a different personality, a different reaction. Her mom totally relaxed. So at least they didn't have those behaviors to deal with. But then she could see the progression of the disease and recognized she really, part of what her agitation was, she can't make any decisions. She can't even make her meals. She doesn't know when to shower. I mean, I don't think they really realized that until she brought her into her home and saw that. So that's something that is very challenging, especially the driving. I mean, there are resources out there that can address it because families have such a hard time taking away keys. That's a whole big item to address. So, so I'm gonna end it. I mean, I have, I will say the one other thing I had this week were 2 young callers, like in their 30s, and they're caregivers, and they really appreciate being able to talk to someone because their peer group isn't there yet. They're in a different place. They're going out to dinner. They're making plans, and they start looking at these young ladies like, why are you worried about nursing homes? Why are you looking at assisted living? I know I was in that place myself when I was 30, so I understand that. So it's helpful for them to have someone to talk to, or a peer, or a peer group, and they really appreciated. The other thing I've heard this week is that quick education. I had quite a few people that said, you feel like you're in kindergarten, and within a very quick time, you have to become a senior and you're ready to take your AP exams. You have to learn this whole medical, and, whatever is good for the care recipient. You have to learn so much in a quick time, and then they don't always have that knowledge base at all. So it's a lot. So I'll just end it with just saying that I have a few things that caregivers have said to me. They don't feel alone because I know you're there. Nice to have a conversation with someone who understands and is knowledgeable. And they give feedback that the system is so difficult. There's so many things to understand, Medicare, Medicaid, equipment, all these things, that it was so nice to have some hand holding to go through these systems. That's it.
Well, thank you, Pam. I'm just going to jump in and say, as Pam had explained, we have a particular program here at Phelps Hospital called Care Connections, but a lot of other facilities and hospitals throughout the county and different states are also realizing how important caregivers programs and centers are. So if you have relatives in another state or another area within Westchester, they may have services available to them. The uniqueness, I think, of what we're doing here at Phelps is the fact that we are partnering with the county. So that allows us to do both the inpatient caregivers that we meet and also community-based services. So because of that, we cover all of Westchester County. So I know some people are listening are professionals, and if you think you have somebody that could benefit from the program, I had posted the number and the email, but again, it's 914-366-1199 is the phone number, and the email is caregivers@northwell.edu. And listening to Pam and what a great social worker she is, and how empathetic she is, and her base of knowledge, you know that the referrals, that they'll have a really good experience, and it's just something that's very, very important. We need to take care of the people who are taking care of of our patients. So that's basically what it comes down to. So if anybody has any questions, I guess we have a few minutes.
Yes, we do, actually. And thank you, ladies, so much. All the information that you shared is priceless, and it's beautiful to see that we have this system set in place for the caring, for the people that care, the caregivers, because like you said, they usually are forgotten. And I had been a caregiver myself, and I can vouch for that. So I understand exactly the whole scenario. And just with the stories that Pam was saying, I've heard so many of those stories so many times. I worked in the nursing home industry as well. And that was the number one thing, everything that she touched upon. So it's great to see that there are resources now in place. But I had a question for you. So if someone wanted to utilize your services, they would go through the community. How would they get in contact with you, via the number or the website?
So you can either call the number or send us an email.
Okay. Great. Okay, let me see if anybody has any questions. Does anybody have any questions for them? No? Okay, let me see. I think there's something in the chat. Amy says to thank you both.
Thank you, Amy.
That you would and your overview of the cases examples helped her to understand what the program provides.
Yeah.
It's a great job. Okay.
Thank you.
I don't think anybody else has any questions. They're saying excellent presentation. It was
Good.
amazing. Yes.
And if anyone has any questions, always give us a call. We're here, right? Between Ellen and myself, feel free to call. If you're not sure, give us a call.
Okay, great. Well, I want to thank you again for joining us, and thank you for supporting our system here with the Boxwood Alliance. And we'll hope to be in contact with you ladies soon.
Okay.
Thank you.
For having us.
Thank you so much. Bye, ladies.
Good night. Bye-bye.
Thank you. Bye.
Bye-bye.